Today's hospitals are a far cry from the healthcare facilities of yesteryear. Life-saving equipment, cutting-edge technology, patient comfort and staff well-being are all now integral considerations in modern healthcare design. And nowhere is this more apparent than here at the Mater Private Hospital in Springfield.
This project and the broader master plan that it is a part of are a huge deal for Springfield and the broader Ipswich community. It's also a great example of what can happen when a major developer, a private healthcare provider, a local city council and state government work together on a shared vision.
This project was very unique because it is the first step in a master plan process, and the engineering had to be maintained and also expandable in the future. We started this process by creating a service corridor that can be fully expanded and integrated into the next phases of the project.
The hospital currently comprises approximately 80 beds, but in the future is expected to grow to up to 750 beds as demand increases. Building services were designed to National Construction Code of Australia and relevant Australian standards, but also had to be designed to the Mater Engineering Services guidelines.
It was really important for us that our consultants and contractors understood the Mater values, which really helped discussions and outcomes on the project.
Quality had always been an underlying factor for the project, and certainly quality for Mater had been an issue about how this project was going to eventually look and feel and work. So we spent some time trying to understand how Mater did their business and how they perceived quality.
The future-proof technology here at Mater is designed for patient comfort and to provide the reliability required by surgical, medical and nursing staff.
Advanced technological designs were important for this hospital, including the integrated communications network, which carries all the information of the building services as well as the user requirements. And there's also the implementation of the individual room control for each of the patient rooms.
We tried to get a lot for a small budget in terms of technology, and so we really focused our efforts on the patient. And so we have, for example, integrated room control where the patients can control the temperature, the blinds and their lights from beside their bed.
The ORs are fully integrated digital ORs that can send images anywhere in the world. So we have to integrate the technology, and engineering is a fundamental component of that. Having not only the consultant engineers but the subcontractors, it meant that we could look at complex spaces in the radiotherapy bunkers, in the ORs, as to how we're going to integrate new technologies.
We work very closely with the engineers to ensure that things like gas panels, services panels, are either toned to integrate into wall panels or timber bed heads, or where possible we can hide them. One of the things we did in the bedrooms was worked with the client and the engineers to incorporate in a bedside pendant, which is very unusual in a lot of hospitals.
We spent some time trying to make the rooms look domestic. We tried to make them have an Australian feel about them, and we tried to make them part of the environment. And it allowed us to give a building that we felt had the right feel for a community hospital.
The deliberate design aesthetic for the interiors of the hospital was obviously to connect with the exterior finishes. When you walk through the building, the colours and tones and the patterns that we've used in the graphics throughout draw upon the landscape of Springfield.
Prototyping is really important, and we're trying to develop a facility that has that hotel feel, but it has to service its original need, which is patient care.
A lot of work has been done with the stakeholders in prototyping the rooms. The patient rooms were built in full scale and then tested with the staff and with patients as to how they work. We know that this design will reduce the number of falls. It will also increase patient satisfaction. So there's encouragement for the family to become part of the recovery process.
We've also focused on family-centred care with a fold-out bed in every single room and no visiting hours, so the patient can have their family member here anytime, day or night, that they need them. This was very much an effort of all the partners. We worked very closely together with people right from the community developer, Springfield Land Corporation, to people like NDY, Oricon, and all of our partner suppliers.
When you got a whole team working in that same direction and have the same kind of idea of why, you get such a successful outcome. And only because of that, I think, we were able to open 4 months early and $2 million under budget. When you humanise that, thereby allowing patients opportunities to have access to healthcare facilities early.
When you come in and you see the marble desks and the artwork, it makes you feel like you're in a place that's welcoming.
You walk past the building when the light's going down and the outside screening lights are coming up, and it sort of twinkles a bit in the environment, and it's a beautiful space.
The Stage 1 Mater Private Hospital here in Springfield is a resounding success. The design and construct teams delivered on Mater's vision for a hospital that places the needs of the community, of patients and of staff at the very core of every design consideration. Ultimately, that's what good healthcare design is all about.